This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Dr. Amy Shah is a rare entity. She is a medical doctor and a nutrition specialist. She understands the mind-body connection, and she knows that food is medicine.
Blueberries have been shown within an hour of consuming them to change your mental health.
How so? She has specific training in gut health and anti-inflammatory food. And she told me about specific foods to improve focusing in ADHD and foods that help when you're struggling to sleep.
The number one thing in terms of what you should eat to improve your sleep is
anyone who is thinking about ways to change their routine in order to improve their mental health and well-being should listen to Dr. Shah's episode of The Vault. She is an award-winning best-selling author, and she's been featured on The Today Show, Good Morning America, Mel Robbins Podcast, and Ed Mylett. Dr. Shah has empowered people to save themselves through nutrition and lifestyle medicine. Thanks for joining me in the vault.
I love this. This is like, I feel like I'm like going to get a bank loan or something or like take out my jewelry.
Well, there used to be precious stones in here like diamonds, emeralds. So
I love that. I think the last time I was in a vault was like to get my jewelry from like that's still in there that I never use.
Well, we create mental wealth here.
Yeah, I love that.
You are one of the rare doctors who focuses on inflammation, which is a really hot topic right now, right?
Yeah. I mean, that mind-body connection really, that's where it really connects is people can understand. And it also makes sense. Like your inflammatory molecules are constantly in communication from brain to body, Well, some of the studies are showing now that when people change their diet, they actually start to feel better. And in some cases, it's more effective than antidepressants and other psychiatric medications. I know it's crazy, this whole world of the microbiome speaking to the brain. So there's this whole world of psychobiotics, so actual probiotics that when you're eating a certain diet, you change your gut. And when your gut changes its bacteria, that bacteria can speak to your brain and change how you feel, how you show up in the world. So yeah, that connection between the brain and our body through diet is really strong.
Well, I don't think a lot of people understand that, and it's not all the same. So when you go to the store and you see yogurt and you see probiotics,
yeah.
What should people really be doing?
Okay, so I think it's really hard because 75% of the grocery store is ultra-processed food. And we know from studies that ultra-processed food is the worst thing for your mental health. People who have higher rates of ultra-processed, the highest consumption of ultra-processed food have 4 or 5 times greater risk of depression and mental health days, what they call. So it's really, really hard because our grocery stores and our lives are built around ultra-processed foods. Even, people who are quote unquote healthy, a lot of our bars and protein shakes and all these things that we have in our normal diet. So it's not just the Twix and Doritos, but it's also like things that we consider part of a high protein diet or something. So it's really hard to navigate. But what I would say is I tell people this mnemonic called 30-33. Mm-hmm. So 30 grams of protein in your first meal, like high quality, unprocessed protein if possible, and then 30 grams of fiber throughout the day, and then 3 probiotic food, 3 servings of probiotic food. So whether it be yogurt, kimchi, sauerkraut, even apple cider vinegar and water can be a really great way. I feel like that's a great start. Even if you start with one of the 30-33, like 30 grams of protein in the morning, that can really start you on the right mental health pathway.
And is that for just adults or is that for anyone?
Yeah, so funny thing is I target this for women, and especially women over 35, but almost everyone can apply it to their life. Of course, depending on what your needs are. But what I always say is people are like, why do you focus on women? over the age of 35. And I'm like, because no one's focusing on women over the age of 35. And as our hormones start to shift, our microbiome starts to shift, and our mental health starts to shift. And we need support around that time. So anyone can apply it in a different way, but definitely for that woman who's entering perimenopause, all through menopause and beyond, this is the perfect kind of structure. And you can be I'm diet agnostic. You could be vegan, you can be paleo, you can be, fish only, you could be, but if you follow that guidelines, that structure, that can be your first step to better mental health.
So what about just in general for everyone? If someone has, let's say, anxiety or depression, what are the 3 foods that they should try to get in their diets every day?
Okay, so anxiety and depression those are 2, as you know, really big ones that get affected by nutrition. Most people don't even realize that even just, I would say, dropping the amount of ultra processed foods that you eat, that would be like number 1.
Okay.
So meaning that if you were going to have Cheetos or Cheez-Its or, I don't know, Twix or even often the ice creams that we get, switch some of those foods to actually homemade or ingredient only foods. So just for people who don't know, ultra processed foods means that they're foods made with ingredients that don't occur in the culinary setting. Okay. So even if you had every ingredient in your kitchen like you were a top chef, you wouldn't be able to recreate some of these like frozen desserts or like a Twix bar, for example, or a Snickers. You would have to use chemicals and that are non-culinary chemicals. So that is the definition. So that makes it easier to identify because I always, everything's processed to some degree. But if you could, number 1, decrease the amount of ultra processed foods you have in your diet, that could be the best and first step. So for example, my daughter loves to she's a teen, right? She loves to go through drive-thrus and on the way home. But if we could switch out one of those meals of the day to a home cooked meal, like the same thing, it could be pasta, it could be easy burrito, whatever, but with real ingredient foods, that is your first step. So that I think would be first and foremost. And then number 2 is really getting food with fiber in it. So for example, I love to recommend like blueberries because you think, well, blueberries are delicious. They have fiber, they have polyphenols, and blueberries have been shown within an hour of consuming them to change your mental health.
How so?
You can improve cognition within an hour. They had children who were eating blueberries and they were finding changes within 1 hour of consuming them. So super easy way to improve your mental health is having blueberries. And I love that. It's like one of my, deserted island foods or whatever when people ask you. And then another one that is extremely important, I think, for people that have concerns about mental health is leafy greens. I think that is maybe, if you had to pick something that was the most impactful for changing your inflammatory levels and improving your gut-brain connection, it would be kind of those dark leafy greens. Something like a baby spinach would be a really easy thing to add to your diet. And I try to pick, there's so many different things we could be talking about, but I'm trying to pick things that are very easy to get and incorporate, like things for even turmeric, for example, is a great way to improve your inflammatory levels. But not everybody has access to it. Not everybody can use it on a daily basis. And same thing with something like omega-3 fatty acids, green tea. Those are all really good too. And those would be other things I would add: the green tea, omega-3s through foods or supplementation, vitamin D through foods or supplementation, magnesium through food or supplementation. So those are like the bonus ones.
I know that like about 5 years ago, I got tested and I was low on vitamin D.
Yeah.
And I was also like, it was during the pandemic. So during the pandemic, and I was just feeling kind of sluggish. And I was like, you know what, let me be intentional about what I eat. So I got rid of all of the processed snacks that I had. I got rid of red dyes because I love some Starburst, Skittles, Swedish fish.
Yeah.
And then I was like, okay, let me be intentional. Started eating blueberries, raspberries, strawberries, fish every day.
Wow.
Right. And then I got tested a year later and like I was so much better and I felt better.
I know. I think that's the thing within days. So the studies show, there's a Nature study that shows within 3 days, your microbiome changes with a radical change in your diet. So like a radical change like you did, within 3 days, you probably start to feel better. So it's kind of cool that we can make these changes and not have to wait for like a month or 3 months or 1 year to actually see the benefits.
Well, and I have a sweet tooth, so I replaced the sugary stuff, the processed stuff with bitter sweet chocolate.
Love.
And I mean, it's totally fine. I think a lot of it is a mindset change as well. So I was very intentional and I said, when I'm eating this food, I'm like, man, it would be really nice to have a cheeseburger. But as I'm eating my salmon, I'm like, I'm doing something for my body. I'm doing something for my mental health. And that also helped me to make that change.
I think that's true. I feel that mind-body connection has been, we talk about, the power of your mind, but really with nutrition, it's kind of intertwined. And so I think it's hard to separate, like, is it just the food itself that's doing the work? Or is it also that you believe that you're taking care of yourself, that you believe that you can heal, that you want to get better? And
it's definitely both.
Yeah.
Most definitely.
And that's why it helps.
What about sleep? So this is something that a lot of people struggle with.
Yeah.
And I think, related to hormones, your sleep is completely disrupted. As you age, you're not just getting old, it's because your sleep architecture changes. And this is both men and women. And then, sleep is disrupted with ADHD, with anxiety, depression, just about any mental health issue, sleep is a problem. So what foods can people eat to improve their sleep?
That's a great question because circadian rhythms is something that I love to talk about because not only does it improve your health, but your mental health is probably the most improved when you improve your circadian rhythms. So circadian rhythms, for people who don't know, is like a 24-hour day and night cycle that our entire bodies are synced to. So even if you're a night shift worker, and night shift workers hate when I say this, even if you work your whole life as a night shift worker, your body and brain still work on a day and night circadian rhythm. And so the more you can match your meals and your sleep with the natural day and night cycle, the better you're going to feel mentally and physically. So the number one thing in terms of what you should eat to improve your sleep is not eat 2 to 3 hours before bed. So having that circadian fasting is a way to sync your body with circadian rhythms. Because if you think about it, thousands of years ago, when we didn't have Uber Eats or refrigerators or access to big meals all the time, you would eat your dinner close to sundown or shortly thereafter, and then you wouldn't eat much at all until the next morning. And that's how our bodies are actually designed. Our gut is supposed to be sleeping, goes into kind of a sleep mode overnight. And so when you eat a huge meal at midnight, for example, you are really affecting both your hormones because your insulin levels are much lower at that time, and you're disrupting your sleep. And your circadian rhythms are disrupted all over because your body's like, wait a second, she's telling me that it's still daytime when all of my other signals are telling me that I'm supposed to be in sleep mode. So there's like a disruption there. And so you'll wake up, you'll feel hungover, and your insulin levels will have been disrupted overnight. And often you feel awful because your digestion is slow late at night. And so you wake up and you feel sluggish, you feel hungover, and it really, over time, can really affect your mood. And I think people intuitively know this because if you think about it, and last time you've eaten a super large meal late at night and how you feel immediately in the morning, and you do that many, many, many nights in a row, and then you're going to affect your mental health for the long run.
Mm-hmm. And also the caffeine is just the
oh my gosh, the caffeine. So perimenopause.
We were on IG like I think a year ago, and you said something. You were like, "Don't drink coffee within an hour of waking up."
Yeah.
Tell us about that.
Okay, so when you are switching from, sleep to morning mode, your sleep waves are going down, your wake waves are going up. You want to let your body transition without food and if you can, without the phone. So I like to tell people sky before screens, get your water in, get some sunlight. And then before you eat or drink something, wait at least an hour or two. Because again, if you think about circadian rhythms and you think about thousands of years ago, you didn't roll out of bed and just have a coffee and a donut. Like that was not something that you could have done.
Yeah, you hunted.
Bodies.
You had to hunt for it.
You had to gather or hunt for hours, maybe a couple hours, or maybe at least an hour or two before. And so to mimic that. And, here's the thing. When you first wake up in the morning, you have a natural cortisol spike. And that is what you want. You want a natural cortisol spike that wakes you up, that makes you feel alert, that turns on your brain centers. So you don't necessarily want to rely on anything to help you get that natural cortisol spike, because when you have coffee, you actually spike it some more. So there are studies that show that over time, your body actually does get used to it. So as you know, if you're not super sensitive to cortisol and you don't have much anxiety and you love your coffee, you'll notice like over time, you're able to tolerate your cortisol spike. But the more you can wait for your natural cortisol to wake you up, have some water, have some movement and some sunlight, and then start your circadian clock with food and coffee, the better it is. So for example, I will wait an hour or two to have my chai or my coffee, and then I'll wait another hour or two before I actually have a full meal.
Wow, so interesting. I don't know if I could wait. I love my egg and cheese, but
no, I think the point is not to be, you don't need to fast all the way till, I don't think people who fast all day or, even past towards lunch, I think that it can be really hard for women, especially in perimenopause, and very stressful. So I think that having a breakfast is actually a great idea especially for women 35 and up. But I think that if you can delay it even an hour, that can be really helpful.
And you said something, I think you said eat like a king
for breakfast.
Right.
Yes. So a queen, right?
Right.
And then princess for lunch, and then a pauper for dinner. Meaning the old saying was always have a lighter dinner than and heavier breakfast. And I feel like when you stick with that, the days that I do have that kind of schedule, I haven't done that in New York, by the way, and I feel the difference because when you're busy, often you delay the bigger meal until late in the evening, and you definitely feel the effects. But I also say that the mental benefits of connection and being in person with a group of people is worth it for me. 1 or 2 days a week, like a Saturday night to do that. And then the rest of the week, I'm eating a light early dinner, having a nice long circadian fast, and then waking up in the morning and not having coffee right away and waiting, and then having my first meal. And when you said egg and toast or cheese or something like
egg
that.
And cheese.
Yeah. So if you can get a high protein breakfast with some fiber, some veggies, fruit, whatever, and even a little bit of probiotics, that's kind of like the ideal way for mental health, that mind, body, gut connection to start your day.
Yeah. I found that when I start my day heavy with the protein and then have smaller meals, I have more energy. I feel better. So I'll have like a lentil soup for lunch that's really high in protein. And then for dinner, like literally every day, salmon and veggies. And it's really light. And I'm not hungry. Like before, when I flipped it over and I was eating bigger dinners, I was always hungry. And before bed, I'd be like, oh, I want to eat something. But I find as I age, as I get older, I need to shift things. I can't be having the same diet I did in my 20s.
Yeah.
So.
And I think when you talked about sleep and food, I think the caffeine, not to have caffeine 10 hours before bed is something I go by. Depends on how fast you metabolize caffeine. But as you get older, and if you are noticing a change in your sleep quality, architecture, difficulty falling asleep or waking up in the middle of the night, kind of bringing that caffeine almost towards just the morning is probably the best idea. And then watching what you eat. So even things like energizing vitamins and things like that. I feel like people don't realize that those are some things that you shouldn't have closer to bedtime, or pre-workout, or a green tea supplement, or these are things that will keep you up at night. And there are even some studies that show that the timing of your supplements, like if you're taking a bunch of supplements and you're taking a lot of energizing, activating supplements later in the evening, that's going to disturb your sleep. So if you're sleep obsessed, like so many of us are, then you're going to examine all the foods and drinks and supplements and medications that you're taking as to not disturb your sleep.
I'm glad you brought that up. I had a patient a couple of years ago. I study high functioning depression, and this patient had high functioning depression, and we couldn't figure out what was causing the sleep disturbance. So I had them keep a food journal and a supplement journal, because they weren't aware that one of the supplements that they were using at the gym was loaded with caffeine, and it was energizing them. Once that was taken out, they were sleeping better.
Huge difference. And I like to tell people that often you need a sleep toolkit. So in perimenopause, as you start to lose that progesterone, which often is more the relaxing anti-anxiety sleep hormone, you start to notice disturbances in your sleep, both, the quality, the architecture. I think it's important to have a toolkit that you can add on. So my basics are always like blackout curtains, or some kind of way to make the room really dark and cold. So 68 degrees is like kind of the temperature that you want to keep it. So very cold. And blackout sound if you can. And don't have food before bed, and not caffeine before bed. No stimulating conversations, like phone calls with your mom about the drama in the family. Like, don't do that 2 to 3 hours before bed. And same thing with the emails. Like, how many times have you checked your email right before bed and gotten something very concerning that now you can't sleep because you're ruminating on the outcomes of that potential email? So that's kind of like the big things that I tell every night and that I do for myself. But then having a toolkit. So maybe there's chamomile supplements, or maybe there's dark tart cherry juice, or maybe there's a valerian root, melatonin, low dose. I don't like high dose. Magnesium glycinate. Magnesium glycinate is one of the best tools, because it's not only is it good for your brain, magnesium, it is good for perimenopause because it's anxiety and cortisol reducing and helps with sleep.
You're right. It's super helpful to think about diet, movement, whether or not you need supplements. And that's something you should really discuss with your doctor. But then there's also the practices around sleep that you brought up, like sleep hygiene. That's something we can all do. People entering midlife, they may have obstructive sleep apnea. And it used to be thought that it was only people who are overweight or obese, but we're learning that some people have it and they don't have the classic physical structure that you would typically see with obstructive sleep apnea. So you may want to talk to a sleep specialist, right?
Yeah. Like, I think that a lot of people that I speak to, either through my wellness work or on social media, they will say to me, I did all those things. I do everything I have. And that's when that is a sign for you to get checked out from a specialist so that you can figure out whether it could be something else, because there are so many different things that could be disturbing your sleep that it's difficult to say based on, just the fact that you can't sleep. So getting evaluated, a sleep study, getting blood testing, knowing like kind of what's going on in your body and diving deeper is definitely necessary.
When I go on conferences, because I travel a lot for speaking engagements, I travel with duct tape. So I cover all the light in the room. I'm the light hunter.
Okay.
Because, I've read that light disrupts your sleep. And if you're someone who's, more concerned about your metabolism and so forth, it can really impair your metabolism. People who are pre-diabetic really need to look out for that, because that stubborn belly fat, that's not for aesthetic reasons, but really because you don't want to develop a metabolic condition. You really need to focus on sleep, because that impacts the way that your body, metabolizes food and the way that you store fat.
I love that because that's absolutely true. So ambient light while you're sleeping affects your blood sugar. And I think people don't realize that because they're getting really, really bright lights late at night. And people don't realize like that Target run that you do at 10 o'clock at night is not good for the sleep. It's the same thing as having an ambient light on. So for example, people who sleep next to windows with bright lights coming in or have a light on, significant amount of light, can really disturb their circadian rhythms and their blood sugar control. And so if you're someone who is trying to improve your blood sugars, and I think for all of us that are in the perimenopausal range, should be concerned about our blood sugar because as our hormones are changing, our blood sugar control is already impaired. And so having ambient light in the room is really going to impair that blood sugar control and also your sleep quality.
And then sunlight.
Yes.
Right? That's a big one.
Okay. Getting sunlight in the morning is the one thing I could recommend to anyone. If you don't do anything that we talked about in this podcast, if you could go out and get a few seconds of sunlight in the morning or first thing, that is something that can really change your mood, your circadian rhythms, and your metabolism. Things like just stepping outside while you're brushing your teeth, or right after you brush your teeth and you just go outside, do some stretches, or maybe it's a full walk. Like this morning, since I was coming here, I didn't have time to do a full walk outside, but I made sure that I got my few minutes of sunlight first thing, right when I was going to the gym. Instead of going to like doing a full session at the gym, I did a little walk outside just to get my sunlight, went to go get some coffee, and then came back. And that is a way to start your day that's going to change the whole trajectory of the day and the week.
Yeah, I love that. Walking has so many health benefits.
Oh yeah. Walking is the only thing, one of the only ways that you can grow your brain as an adult, because, you know, your brain is fully developed at age, say 25, but you can grow those hippocampal areas through walking. And, you know, there's certain dietary things that you can do to support your brain health too. But I think it's really cool that something as simple as getting sunlight, walking, getting more magnesium in your diet, getting more fiber, probiotic foods, protein. These are things that can support your brain and mental health as you age. And if you support that with a good community, some good thoughts, like we said, the power of your own thoughts, your best years can happen in the 40 plus age. And I think that's counterintuitive to what we've been told by society. Like, oh, your best years are in your teens and 20s and like everything else is downhill. And I think that if you actually understand the science, it can be the 40 plus years can be the best years of your life.
I wouldn't trade my 20s for any. I don't want to do that again.
I also was in residency and it was terrible.
So much trauma.
Yeah, exactly. Oh my gosh. Yes. So
I always ask my experts to recall a time in their lives when on the outside, everything was put together and everyone thought you were doing great and you were like crushing it, but you knew on the inside you were really struggling. And how did you get through that?
I love this question because this is exactly what happened to me. So, you know, my parents came to the US when I was 5 years old, almost 5 years old. And they came from India to give me a better life because I was a girl. And they thought, as a woman, you'll have more opportunities and to impact the world in a different way than you would have in our country, right? From our community and our ancestry. So when I finished medical school and I was in my first practice, and I was thriving. I mean, the practice was thriving. And I thought to myself, oh my God, is this the impact that I'm going to make to the world? Is this the thing that I came here to do? And I thought, no, like I was miserable. I literally was drowning in paperwork and patient care and being a mom to two little kids. And I was making all this money, but I was so unhappy. I hated my body. I hated my life. I hated how I was acting towards other people because I was so stressed all the time. And so to me, I really had to look in the mirror and say, like, this is not what I want to be doing. And this is not what I'm here for. This is not my purpose. And then I had a huge car accident. Like because, you can have these thoughts, but you can be just stuck in that life because I was too busy to even make a change. I knew I had to, and I kept hearing this voice. But the car accident was something that paused my life and in every way. And it made me really rethink what I wanted to do. And I was like, this is my moment to make the change that I want and go towards this more purposeful life. And so to impact people in the way that I've always wanted to and let them see their own gifts through the things that I know will help them. And it's a tough thing, right? Because we work so hard and so long to get to where we were. And people were like, what are you doing? Like, why would you take time away or not grow this thing? But it was the wrong thing for me. And so I had to shift. And so that was the time in my life that really changed everything.
I mean, I think a lot of people in medicine feel that way, but they don't do anything about it. They ignore their gut,
Yeah.
And then they just do what they think they're supposed to do.
And then maybe like you'll retire one day. Like the thought in my mind that one day I would retire and then I could pursue my purpose was just like miserable. Like, how do you go through 35 years doing that?
But a lot of people do it.
It's crazy.
Well, thank you so much for coming into the vault today and sharing your wisdom.
I am so grateful. This was such a fun conversation.
And tell us about the things that you have in the pipeline.
Yeah, so I'm working on a new book that is, I'm just writing it right now. I share a lot of social media things on at Fasting MD. That's kind of my main place that I like to share. My website is amymdwellness.com. I have lots of new things coming up. So lots of ways to stay connected. So they can hop on there.
And where can we find you online?
That's amymdwellness.com. You can see all the things I'm up to.
And your IG?
Fasting MD.
Okay, great.
Thank you.
Thank you.